Our approach to cancer management is attention by site-specific combined cancer management teams comprising radiation, surgical, and medical oncologists. The team examines the patient and advises investigations. On completion of investigations, the details are reviewed by a multidisciplinary tumor board to decide whether the patient will benefit from proton therapy. Our team of physicists and clinicians conduct a pre-planning audit. Following this, the clinicians contour the target as well as the organs at risk and prescribe a treatment plan. The medical physics team then creates a proton therapy plan and often a rival tomotherapy plan for comparison. The ideal plan is selected and confirmed by the clinical and medical physics teams. This ideal plan is the one that administers the best possible dose to the tumor while ensuring that the dose to normal structures is restricted.
An APCC accurately model, quality assured, and a protocol-driven intensity modulated proton therapy is delivered to suitable patients in 3 treatment rooms using dedicated pencil beam scanning nozzles and the quad beam CT.
Proton therapy improves local control and therefore outcomes in some situations, reduces the toxicity of radiation in others, and does both in many clinical situations.
Tumors of the central nervous system are excellent indications for proton beam therapy, both in children and adults. Various aggressive benign brain tumors such as meningiomas, pituitary adenomas, cranios, especially located in challenging sites, can benefit from proton therapy with or without surgery. Proton therapy is also particularly effective in almost all childhood brain tumors, where the long-term cure rates are high, and because it spares adjacent normal tissues, these patients are able to achieve significantly superior long-term quality of life than those treated with conventional radiation. Our experience in Apollo Proton Center in treating a fairly large number of patient population with CNS tumors has been quite encouraging.
Most children with cancers, although have excellent long-term outcomes, are susceptible to various medical and social issues which can significantly affect their adult life. Among the various modalities and innovations used to address some of these is proton therapy, which is probably the most preferred treatment option for children, adolescents, and young adults with cancerous and non-cancerous tumors that can be treated with radiation therapy. Prospective studies from several reputed centers across the world, including ours, have shown that by limiting the radiation exposure to healthy growing tissues, proton therapy leads to lesser probability of late effects such as hearing loss, neurocognitive impairment, hormonal disturbances, growth abnormalities, cardiac issues, reproductive failure, and several others, including lesser probability of second cancers.
Head and neck cancers are the commonest cancer in India, and this is naturally our area of focus. In these cancers, proton therapy reduces the long-term and short-term consequences of treatment as compared to techniques like IGRT and IMRT. In the short term, we have noted that this means less risk of pain, of infection, of requiring a feeding tube, and a smaller risk of treatment interruption. And in the long run, this means a better chance of getting back to or preserving a normal life. Proton therapy has a special role in both the elderly as well as in young cancer patients in whom it reduces the risk of having a second cancer. Proton therapy also has an important role to play in base of skull lesions such as adenoid cystic carcinomas, paranasal sinus tumors, and chordomas. In addition, we have noted a special role in post-operative oral cavity tumors, which are, of course, of special interest in this part of the world. Proton therapy treatments are closely supervised and patients are reviewed regularly. On completion of proton therapy, the patient is reviewed by the clinical team and counseled on post-treatment care.